Hey, Pentucket community, it's Dr. B, and I know we've got a few positive cases now in the schools, and with that comes a whole slew of questions. So I've invited in Diane Dardino. Ms. Dardino, how are you doing today?
I'm good, thank you.
All right, so for those of you who don't know, Diane Dardino is a public health nurse, and she works with all three towns and is very involved in the COVID, in all COVID cases, right? And you work with a couple other districts too, or is it just ours? I can't remember.
No, I do work with a couple other districts as well.
Right. So I think it's fair to say, just for people to put this into context, that you have your hand in three towns. I know we meet every Wednesday morning with the local health agents from each town. But you are kind of the go-to person for the towns as well when the case pops up. Is that a fair assessment?
That's a lot, but
I
will find the answers if I don't
know you work with. So I want to give people the context. So we're going to go over a bunch of questions that commonly come up, and just since we've got you here, we'll get the answer. So first question, and here. So what is the protocol? If we have a staff member or a student that tests positive, what is the protocol? What's supposed to happen when there's a positive case? Do they just call the school, or what is it? What's supposed to happen?
So when there's a positive case, the case is notified by the ordering physician that their test is positive, or the establishment where they got the test. That sometimes there's a portal set up where the person receives the test on their own time, where they're checking a portal, and then at that point, that person moves forward with the information, and it would be very helpful for them to notify the local board of health,
sure,
the school system for sure, and at that point, the local board of health can further advise them as to how to move forward and help their close contacts and determine who those are and get them under control.
So what I heard you say, and I guess this kind of goes into this next question about who oversees the case. So if there's a positive result and a physician gets that, they pass that on to the local board of health, and then that local board of health oversees the entire case. Is that correct? Or the investigation or whatever it is that's done.
That is absolutely correct.
All right. So, and I think there is some confusion. Like, some people think that we, as a school district, like the principals, the teachers, they're supposed to be doing the investigation, and that is not our role. Our role, I think you've gone through this now with us 3 times. So we're primary collaborators that help you. You have questions, you tell us what we need to get you, and we get you the information.
Exactly. And it's been fantastic collaboration at that. At some junctures, then the school nurses are asking questions in order to make some determinations so that I can reach out to the appropriate people.
Yeah, and I think so. You keep leading into my next questions. This is not fair, because I think what you just said about the school nurses, and I know you end up making a lot of phone calls to community members because of this term, close contact, and those are the conversations. The nurses help identify those. I think the school administrators sometimes help with those, and then of course there's outside community members. So can you first, what is a close contact? Who's considered to be a close contact?
So a close contact is specifically someone who has been within 6 feet for greater than 15 minutes of a confirmed positive case.
Okay. So just let me walk down this road then. If you were a close contact and I'm just regular, no big deal, and you and I were hanging out, am I now a close contact? I'm not COVID positive. I'm just a regular, we were just hanging out. You might be a close contact, and do I have to get tested? Am I a close contact now?
No, you're not. You can only be a close contact if you come in contact with a confirmed positive case.
And again, that contact has to be within that 6 feet for a extensive period of 15 minutes or so.
Correct.
Okay. So now let's go down and ask you this other. So if you're positive and you and I are hanging out again, and I go, I give you a high five. and then I walk away. So we've interacted for maybe a minute. Am I now a close contact?
You are not.
Okay. So I think that's a tough one for me to process. I think for everyone else to understand. But so the close contact, just to make sure I got this summarized correctly, we're looking at someone who's within 6 feet with a COVID positive person for 15 minutes or more. Those are okay.
Correct.
All right. So leads me to my next question now. If I have been exposed, and that exposed still is the close contact, I guess, right? That's the same thing.
Correct. Same thing.
So if I am exposed and like you called me and say, hey, Justin, you better go get notified because you better go get tested because I tested positive. Should I go get tested right away?
So there is an incubation period for the coronavirus, and it's anywhere between 2 and 14 days. So it's much more accurate if you wait a few days. It's suggested that statistically for between days 4 and 6, approximately 50% of positives show symptoms on those days and test positive on those days. So you want to cast a bigger net, so to speak. And as you go further down the 14-day incubation period, you will continue to potentially be positive.
Sure.
The instance becomes less as you continue down to the 14 days.
Right. Okay. All right. And I guess that makes sense. So don't get tested immediately. And I think if I was notified, I should probably call my local board of health.
Yes.
And okay. So I can find their number on like the website, the town websites or something like that. Is that the best?
Yes, of course. You can call the town hall and they'll put you in direct contact with the board of health.
All right. So I'm sorry, I asked this question already. Who do I call if I have COVID questions? But that is the local board of health. You can call town hall and ask the local board of health. They have, they're the ones following all the state protocols from the Department of Public Health. And just, I think for people to understand, we do have a blend here. Like, so Diane goes ahead and she's following the Department of Public Health directives. The school district is following Department of Elementary and Secondary Ed directives, and they both dovetail with each other. So they're very similar in terms of what happens. But here's one thing that I know comes up at just such an incredible number of times. We saw this last week when we had our first positive case. And the question is, so as a parent, why aren't I told the name, grade, or any other identifying information of the student who tested positive in the school? I think you know this certainly from a HIPAA standpoint, and I know this from a FERPA standpoint. And why don't you just tell us what that is, what you're allowed to tell even us?
Right. So that's been a compelling issue the whole time. Obviously, people want to be empowered with information, and that's important.
Absolutely.
But there are laws that protect people's health information and students' personal information as well. So we have to be very careful about the information that's provided. So following those laws and regulations, we can only minimally discuss cases even within the school. And so the information is not for everybody's knowledge, the specifics. So we give out the information we're allowed to give out, and anybody who is in close contact or considered a close contact will be notified. And if you ever feel like you're a close contact, certainly reach out to the local board of health and we can help you make that determination.
Yeah, I appreciate that. I mean, it's a real hard pill to swallow for parents who obviously trying to make sure the kids are protected, and even for our employees trying to make sure they're protected. That when we get this information, we don't know all the details. We just know it was a student, and then we do put that in the local board of health to go through and do their investigation and notify those close contacts. And I think another part I'll just mention is the timing of the information when that information goes out to parents so I'll just speak for the school district. We want to make sure we have all the correct information before that letter goes out to parents. And typically that means we are waiting for the Board of Health to complete its investigation or give us the approval to say, yes, now is a good time to do that. I think that's just, I think, important for people to realize. And then, so final question here, and this one comes to me quite a bit, but I know with the local health agents, we've discussed this quite a bit. And I think I brought this, I know in our meeting last week, I brought up a COVID scenario, and it happened that we ended up having a similar COVID scenario. But at what point would or should the schools close? And shouldn't it be after one single case? And I'll preface this with you, Diane, that when this started, when we started going through possible situations in the late spring, early summer, I made the comment, when there's a single case, I think at that point we just close things down. But of course, the rules changed of what was going to be set up in the school. So can you talk to us a little bit about this question, about why we might or might not close down after a single case?
Sure. So it takes obviously the collaboration between all three towns' boards of health and the school district itself before a school can close down. And there's also a protocol with DESE, the Department of Education, that needs to happen, and everything would get reviewed at that point. But it really needs to be considered whether or not there's community spread within the school itself.
Right.
So if there's no community spread within the school, then there's no reason to close the schools down.
So when you're saying community spread, and this is one of the things that I've spoken about, I think a few times, and I know we often talk about this, because obviously all of us are concerned. I'm definitely concerned. Our number one priority is to protect our students and employees. And what you and all the health agents have constantly said is, when students are in class, they are 6 feet or more apart. They're wearing masks, and we have the washing and things like that. So the community spread you're talking about could take place if we move people in closer, if masks were off, because then there would actually be exposure. There would be exposure at that point, correct? Because we'd be within the 6 feet, and this is, I guess, one of the things that comes up about when are we going to have everybody be able to come back full, and if we do bring back people full at any point in time, and there is a positive case, then there would be community exposure. Is that correct? Is that fair to say? I guess
that is fair to say. When we're talking about the school community, so we have three larger communities. We have the school communities, and it is fair to say that once you breach that 6 foot, 15-minute protocol, you're going to develop situations where exposure is highly possible. Yeah. Classes are obviously longer than 15 minutes. So then you would be in a completely different situation altogether.
Yeah, I mean, that is, I know, I say this all the time. I know things are not ideal the way school's set up this year. I'm very happy that we have students going to school, and I'd love to be able to keep that going. But the idea that we could put everybody back in the schools in 5 days a week, right now, 3 feet is the minimum we're allowed. I think that the state will allow us to do 3 feet. But I think we see here with positive cases, if we had done 3 feet and we had 3 positive cases, we would have school community spread at this point right now, right?
We would most likely be closed at this point.
Okay. All right. So I just want to appreciate you coming on and answering those questions. I'll make mention I know in the description below this video, I've attached a link that goes to people who have questions about the COVID-19 protocols, what to do if there's a positive case in the community, a bus, or in a school. You can go through, you can look at that link, and that was updated. It's updated pretty consistently. They first came out in July. It was updated again in August. I believe September 14th is the last time that document was updated. So if you're watching this video, go ahead and take a look. But Ms. Dardino, thank you so much. I really appreciate you coming on and providing this, because I had questions over the last week. We've certainly got a lot of these questions. So thank you so much.
You're welcome. Thank you.
All right. Take care, everybody. Be well.